And thank you so much for tuning in for Community Conversations with Dr. Liddell Lewis. Again, we have another fantabulous guest. We have with us today Nurse T.
Hey, everybody. How you doing out there?
Well, you know what? At the end of this podcast, they're going to be well because, per usual, you specialize in keeping the community well. So, and we appreciate you, Nurse T. But let's go ahead and allow yourself to introduce yourself. Who is Nurse T?
That's a good question. I ask myself that every single day. Who is Nurse T? Nurse T is a compassionate person that cares about the wealth and the health of the community, that was born and raised in the city of Flint. Never knew or never thought in a million years that I would be in the community educating to this degree and being known as Nurse T. So when I ask myself every day, who is Nurse T, it humbles me because the community gave me that name because they couldn't say my full name. And so I would say Nurse T is a person that understands how it feels to be overlooked, undervalued, not appreciated, a person that understands what it's like for patients to feel devalued, a person that knows and have experienced caring for patients that didn't have appropriate health literacy and understanding, caring for patients that may have been overlooked and not heard, and patients that may have had to be frustrated to feel like they needed to have their voice heard. So to sum it up, I ask myself that every single day, and I would just say that Nurse T is a person that God created to empower others to become better version of themselves.
And also, I know that you challenge many of us to activate our healthcare power, right?
Yes.
Yeah, but we'll get into that in a second. But I would like to know, so since now that we know who you are, what is your role in this community? Because you wear a lot of hats. I mean, playwright, you're author, you are, well, y'all let you tell who you are.
I'm a nurse. I've been a nurse for almost 24 years. I'm at a level 1 trauma, Hurley Medical Center. I've served in lots of capacities. I was a supervisor of a real busy med surg unit before I became the patient resource and community advocate. I have experience in case management, substance abuse detox, and I used to work for Flint Odyssey House. I have experience as far as being an instructor. I was a clinical adjunct instructor for both U of M Flint and Baker College. I've did home care. I've worked in cardiac, renal, rapid response team. I've done a lot of things internal in the hospital. And now my role in the community is to advocate for patients, to create safe spaces for residents to be able to receive health education, to improve health literacy, so they'll have a better understanding of healthcare so that they will actually know how to navigate through healthcare systems. I know that there is a lot of challenges when it comes to patients coming into the medical centers. And even though I put such forth an effort to try to change systems, I know that me by myself, I can't change systems. So what I focus on is empowering people to know how to navigate through the system. So the more our community residents are familiar with health concerns, signs and symptoms, and risk factors, the better they are able to articulate and communicate their concerns.
So you sound like you're a health advocate, a healthcare advocate. Is that what you are?
I would say so. I advocate for the community. So if I'm in spaces to where we may have different organizations coming into our community and they want to see how is it going to fit with Flint, I make sure that I advocate for Flint and share that Flint is a unique place and that Flint has some suspicions. And I know a lot of people think that we are resilient, and I believe that we are. But a lot of times what works for others don't necessarily work for us. And so I always advocate for people to get to know Flint, to be familiar with Flint, to be familiar with the concerns that Flint have, so that they can be able to value the resilience that Flint has.
Now, when you say advocating, you've done advocated on like some major stages. You went to Washington, D.C. advocating for Flint. Is that correct?
Yes, I was with the National Minority Equality Forum. A couple of years ago on Martin Luther King Day, they wanted to have a health event. And so they was like, I would say they called me 3 days before Christmas, and they said that they needed some assistance with community engagement and connecting resources. So I was able to be instrumental in that. I was able to educate on cancer health awareness. And so when I did have the opportunity to go to Washington at the debriefing, I was able to share concerns about our community and cancer. And also, I was suggesting that a lot of times when our patients have cancer, we have resources. Some hospitals have resources. Hurley has a breast cancer navigation program, but that focuses on that. But what I was saying is that a lot of times when people do have cancer, they need funding to be able to continue because they lose their employment. So I was able to mention it, there. So, yeah.
Okay. So what encouraged you to take your message, your advocacy, outside of the four walls of Hurley? Because what you're doing, this is unique. Has this ever been done before?
No. After COVID, I want to say revealed a lot of disparities. COVID revealed a lot of pain for the community. COVID showed us that there was a lot of inequalities, injustice, and that a lot of patients didn't feel like they got treated fairly. So as a result, the 3 hospitals met, because Michigan Hospital Associations, which I am now on their Equity Council for Patient Family Engagement, they met, the 3 hospitals, Ascensions, McLaren, and Hurley, and they was talking about the disparities and everything that impacted Flint, and what were some of the solutions that the hospitals were going to put in place to be able to assist with that. So one of the things our CEO did was, instead of creating another C-suite position, she wanted to create a boots on the ground position. And so once the position came open, I took a leap of faith. I applied for it. I was able to get the position. I received a job description. I didn't really know how I was going to transition or build a position. So what I did was I just started connecting with the community, because the community knew me from being in the community as being a minister or from writing plays long ago. But they didn't know me as a community advocate, especially being sent out there, from Hurley Medical Center. So what I did was I started connecting with community organizations and listening to the community and listening to their fears and their concerns. And one of the things, my first meeting actually, I was behind Bryant's school.
Bryant.
Yeah, it was behind Bryant's school, and I remember sitting there, and they was having a listening session, and a lot of people was just talking, and so I raised my hand, and they turned around and they looked at me, and they was like, "And who are you?" And at that time I was a Nurse T. I was like, I'm Tarnisa Martin. I'm a nurse from Hurley. I'm here to connect and engage and see what can I do. And one of the questions that they asked me was, "Are you from our community? Do you even live in our community? Because we don't want to hear nothing from nobody that don't live in our community. So I had to be honest. I had to show full transparency and say, no, you're right. I don't live in Flint anymore. Not by choice, but it's just because, I got married previously, we moved to different school districts. But I've always worked in the community of Flint, and Hurley is right in the inner city. So one thing I was able to share with them is no. I was honest. No, I don't currently live here, but I grew up at Brownell. I grew up at Holmes. I went to Northwestern. I was considered an at-risk youth because I was on the north side of Flint. I was pregnant at 17. I had a mediocre GPA when I graduated school, and I've been a manager for the last 12 years. And so I took a leap of faith and left a job that was 99% guaranteed to come out into the community and care for the community that I grew up in, because I seen how they felt at bedside. And so with that was kind of like the introduction and the acceptance to where they welcomed me. And then I asked them, what is it that you want from me? And they said visibility and consistency. They said, we don't want anybody to come into our community and start educating us and caring for us, and then they disappear.
Was I at that meeting?
Yes.
Okay.
So that stuck with me. So for the last 3 years, I made a pledge that I would be visible and consistent. And so I've literally probably been to every pocket of Flint. And I wasn't setting out to become quote unquote Nurse T. And I would say it was even at that meeting when one of the ladies was talking about heart condition. And she put me, we had a private conversation, and she was like, well, I can't say Tarnisa. I'm not going to say Tarnisa. I'm going to call you Nurse T. And so it was that day that Nurse T was birthed. And it was that day that I was humbled, and I remembered where I came from, and I made the pledge to be consistent and visible into the community.
So is that why you focus so much on the north side?
I focus a lot on the north side because my job was created to serve the Black and brown community.
Okay.
And a lot of the disparities are on the north side. But to try to create equal access, even though my focus is on the north side, I try to hit all sides. I try to go to the north, the south, the east, the west, and downtown. Downtown is the middle spot. But yes, because when we look at disparities and we look at like heart disease, diabetes, stroke, kidney disease, we look at a lot of those things, they mostly impact the Black and brown community, and a lot of us happen to live on the north side. And I'm from the north side.
Well, you said end up.
End up.
Yeah, you get a pass here. You get a pass.
We don't need a pass.
Ooh, wait. Okay, then.
Wildcat.
All right, Big Red, everybody. But so with that being said, you mentioned access. So when I hear access, I think of I'll say places where you go for treatment. That's one of the branches of access. And I've seen you in the community with this game that I adore. And it's a spin the wheel game where you pretty much you ask the people, is this when you go to urgent care or is this when you go to the emergency room? So can you please let our viewers know a little bit about the difference between emergency room and urgent care, and when you should go to urgent care versus the emergency room? Because unfortunately, a lot of people use our emergency rooms as primary care physicians. And so go ahead and let our audience know when is the appropriate time to use urgent care and the appropriate time to use the emergency room.
Okay. So the game that she's referencing is Know Before You Go. So we created a flyer that educates the community on whether they should go to the urgent care or whether they should go to the emergency room. And it's actually just a guide. A lot of people use the emergency room as their physician office, which I can sometimes understand because sometimes it's hard for them to get into their primary care physician, or they don't have a primary care physician, or they just panic and they just come to the emergency room. The urgent care, we have a couple urgent cares. We have one on Center Road, we have one in Lapeer, and we have one that's actually at Hurley Medical Center.
Okay.
So the urgent care is like a clinic. So like say if you have minor scrapes, burns, flu-like symptoms, coughs, minor issues, you can go to the urgent care. But if you are experiencing anything like poison, like you've been poisoned, you have any kind of suicidal thoughts, or you want to harm yourself, you're having chest pain, stroke-like symptoms, anything that's impacting your medical conditions that's severe, any gunshot wounds, any kind of trauma, you want to go to the emergency room. So I created the wheel because one thing I learned about educating in the community is that even though they typically say that we have a reading level of third grade, so you want to make everything simple. But what I realized is nobody wants to be seen or viewed like they don't know.
Correct.
So I created the game to make it fun because what I realized is even people that have quote unquote higher education, they might not be health literate or they may not know. So I created the game to make it fun, and all of the education is created so that nobody will feel ashamed.
Right.
Everybody will feel empowered. So they spin the wheel and then they choose, but the answers is everywhere visible so that they can see. And that's how most of the education is.
Okay. And so you were talking about signs and symptoms of when you may need to actually go to the emergency room. Very important because we're talking about different parts of the body. They are affected by different things. When you come to our meeting, you talk about the health tip of the month. And so that sort of kind of piggybacks off that. So what is the health tip for this month? What should we know about our body in the month of February?
So February is designated. It's designated for several things, but the focus that aligns with my job and my purpose is health, as far as your heart health awareness. So you will see a lot of education on heart. And you will see people might be wearing a red ribbon to bring awareness to heart health awareness. The one thing about heart health awareness, when we look at our heart, we look at taking care of our heart. We look at the basic things that they tell us to do, which we are not always compliant with.
So, yeah.
I can say for myself, even though I'm fine.
Oh yeah,
Fine. Super fine. I'm
right.
in a real
Ask
radical
your daddy
raw
fine. That one is fine.
cut look today. This is just the natural version of Nurse T. But I will say things like high blood pressure. High blood pressure is a silent killer. High blood pressure is one of the leading causes of heart disease. A lot of African Americans or minorities, especially when you look at the Black and brown community, we go undiagnosed, we go undertreated, and sometimes we don't even be compliant with our medications because of sometimes how they make us feel, or we don't even know that we have high blood pressure. I can say when I set up hypertensive clinics or in the community, if I do education and we take about 50 blood pressures, it's usually 39 or 40 of them that has hypertension.
So what's the rate? So, because it used to be 120 over 80. So what is the...
So 120 over 80 is kind of like basis, but anything over like 120 over 80 is starting to progress you to the stages. And so a lot of people say, oh, I'm not hypertensive, or I don't have any hypertension. I don't have any issues, but when we take their blood pressure, they're like 128 over 84, and that's kind of like progressing into stage 1. So it's just making sure that they familiar with their blood pressures and they know the blood pressure scale, which they can look that up or they can email me and I can get that information to them. I have a whole newsletter on it, but not being afraid to take your blood pressure. And the reason that I stress that is because a lot of times we don't want to know our numbers. Because when we find out our numbers, and then that means that we have to do something about it.
That's true.
I can speak for myself. I went to the doctor one day, and they was like, "I'm gonna take your blood pressure." I'm like, "Okay, normally, that's routine, right?" But I didn't go to the doctor to have them check my blood pressure. I went to the doctor because we had a new doctor, and I wanted to meet the doctor. I wanted to see who had, took over.
Right.
Who's going to be responsible for my care. So I go in, they take my blood pressure, the cuff is too tight. I tell them the cuff is too tight, that's why my blood pressure high, because you got to make sure you have the right cuff. Come to find out, guess what? My blood pressure was like 130/90. And I was like, that blood pressure don't belong to me. So that was stage 2. So I say that to say that at any given time, anybody can be hypertensive or be diagnosed with high blood pressure. So at that moment, I was like, I'm stressed. I got a lot going on. That's why my blood pressure is high. But I say that with all full transparency to say is that it's good to know your numbers. And nobody is exempt. Even though I'm out here educating everybody to take care of themselves, I still have to be responsible and take care of myself. I still have to do the necessary things. I had to start exercising on a regular basis. I had to start drinking more water. I had to let go some of the pop. I had to cut it out because of all of the salt, and everything that's the caffeine and everything that's in the pop. So.
Well, let me ask you this question, because this is a major question. So say I have the courage enough to take my blood pressure, to see my numbers, and say my number is 140/95. How do you know when is the appropriate time to seek medical treatment for your blood pressure?
So normally when you're in a hypertensive crisis, so like 140/95 is high, but it also depends on whether or not you're having any associated signs and symptoms.
Okay.
So normally what we'll say is when you do take your blood pressure, if you have a cuff, you take your blood pressure with your feet flat on the floor, you put your arm up, you put your cuff there, then you watch your cuff. So then if it's high, then you wait 5 minutes and then you take it again. And so now if you're not on blood pressure meds, but you do have a cuff and you're just monitoring your blood pressure, so you need to let your healthcare professional know so that you can get in, because it takes a healthcare professional to actually diagnose you with high blood pressure. But like say, for instance, say your blood pressure is 180/100, and you're short of breath, you're having blurred vision, you're having pain in your left arm, you need to get to the medical center. Because when you have high blood pressure and you have those associated signs and symptoms, and then it could be leading to a heart attack, a stroke, or anything. So, but sometimes if your blood pressure is 145/90, as you mentioned, you could take it again. And if you're on meds, you may need to call your physician so that they can readjust your meds. What happens is that I found out a lot of people that's on blood pressure meds, they take their blood pressure meds on 2 to 3 days before they go see their doctor, so that their blood pressure could be low. But I just have, I told the physicians that that's what you guys were doing. So we're on the lookout for that. Yeah, I was a snitch. They say snitch get stitches, but I'd rather snitch on that than to have you guys, not taking care of yourselves.
Well, we don't call that snitching. Snitching is only when you get something out of the deal that's mutual, But we call that health reporting.
Oh,
that's what you're doing. Yeah. You're a health reporter.
Oh yeah, health reporter.
Crime reporters. You're a health reporter.
Yeah, for the good of the community.
For the good, absolutely. So you keep health reporting.
Yeah.
Okay.
I like that.
So, all right. So let's go ahead and transition to some other things that you're doing. So I hear that you are an amazing playwright, an amazing author.
Yes. So I love writing. I love talking about the story. I did write a play many, many years ago called Homegirls. It focused on the street life offers no respect and no future. I was able to host it at the Whiting Auditorium, and I think that from what I'm told, that we were the only play that actually sold out the Whiting to full capacity. And we came back and we sold it out again. And it's very sentimental when I talk about Homegirls, because at that time I wanted more than anything to be a playwright, and I wanted more than anything to be successful at that. But I let fear stop me from pursuing my dreams. So I put my dream on the shelf. So that's another reason why I'm passionate about empowering people to fulfill their purpose and not forfeit their future because of fear. Because I know what it's like to have that dream and that passion, and you let fear set in. As far as writing my book, All Is Not Lost, You Can Still Bounce Back, Heal, and Win. I decided to write that book after divorce. I was, in a marriage for 30 years, and then I got divorced, and that was a hard time for me. It was a dark time for me, and some parts of me thought that I had lost everything. But through faith, through God's grace, His mercy, I realized that all was not lost. And so one thing that I think about my book is the countdown. You know, when you're in the box arena and they're like 1, 2, 3, 4, 5, 6, 7, 8, 9.
Ding, ding,
I was
ding.
down into the 9th count. But before the 10th count, before they could declare that I was down and that I wasn't getting back up, as bad as I say the enemy, as bad as the enemy wanted me to stay down was how bad I wanted to get up. And I heard God say, "You not going out like this. You got too much left in you. You can't forfeit your future." And so I got up. And I wanted to be transparent and show the rest of the world that if I can get up after being married for 30 years and feeling like all was lost, you can get up too.
So how can we get this book?
It's on Amazon. You can order it off of Amazon, or you can contact me and I can get you a copy.
Well, you said contact you. You know that is the next question. So how can the viewing audience get in contact with the infamous Nurse T?
They can call me at 810-579-6550, or they can email me at justasknurset@gmail.com.
One more time for the viewing audience.
810-579-6550, or justasknurset@gmail.com.
Great, because I have my own copy, and it is amazing.
Oh, thank you.
Oh, no, thank you. Yeah, I'm learning how not to be down for the count. Might feel a little woozy, but you can't knock me out.
That's right.
Absolutely.
That's right. And if you do, it's only temporary.
That's it, because I'm going to bounce back.
Right.
Hey.
The bounce back is always better.
The bounce back is real. So anything else you'd like to share with the viewing community?
I would just like to say thank you. Thank you for giving me the opportunity to be passionate and to share my passion. And I always say, it's never your profession that drives your passion, but it's your passion that drives your profession. So thank you.
Absolutely. And I would also like to say thank you, Nurse T, because you are an instrumental part of the Second Ward community conversations that we have every third Tuesday. You not only come and educate every single meeting about a different health tip of the month, but you were also able to supply blood pressure machines and just valuable tools that we need to be healthy and stay healthy. But not just that, your partnership with Michigan United allows us to receive vaccinations during the meetings, to get our blood pressure checked during the meetings. So you are adding value to these meetings, but you are adding value and you are helping revitalize the Second Ward and keep us healthy. So with that, we thank you so much.
Thank you.
Yeah, and we thank you so much for tuning in. So if you have any questions about your health, because your health is your wealth, and if you can't do anything else, Nurse T can show you how to activate your healthcare power. Can you tell us a little bit about that? I want to close with that because you get the whole room hyped when you talk about activating your healthcare power. Let's go, Nurse T. You know what it is.
I want to talk to some people in the room that want to activate their healthcare power. What? Activating your healthcare power don't start with the physician. Activating your healthcare power starts with you. Are you ready to be healthy? Are you ready to be whole? Let's activate your healthcare power.
And with that said, thank you all for tuning in. Be blessed. See you next time.